In terms of when knowledge mobilisation can happen, and I have already mentioned that it can happen really from the start, getting people in to work on the process in terms of deciding what research will actually be useful. So for research design, things like priority setting partnerships, agreeing, as I already mentioned, on what kind of outcomes are most important in reviews, what outcomes matter most to patients, for example, that should be addressed in systematic reviews so that we can understand the evidence base available around them. So that's informing what kind of reviews are done and whether reviews are done. So really from the very start of the process in terms of design, knowledge mobilization can also happen during the process of a review. So for example, working with potential knowledge users to better understand what their perspective is on the way that we do reviews. So an example of that would be the consumer reviewing that's done by Cochrane. I'll put a link to that, which is where people with lived experience are actually supported to assess and critique aspects of reviews to say whether they think they're right. So it's about recognizing that they have that lived experience knowledge and what do they think about the reviews that we're doing. And equally kind of in terms of collaborative analysis. So what do the findings that we uncover, what do the results of our synthesis, what do they mean to other people, help with interpreting what should be the next steps or who needs to know about them. And so that leads us to the final stage of research, which is about research dissemination. And although I said that knowledge mobilization is absolutely not exclusively about dissemination, it's still a key part of it. You know, as I've mentioned, it's about people having access to findings and being able to use findings. And so that can involve working with users to actually co-design evidence outputs. So what do our summaries or our evidence briefings need to look like, working with users to understand that, and equally working with users to help get research out there, to work with, for example, champions or work with networks who have influence. So we're actually getting awareness of evidence out to people so that they're aware these reviews actually exist and aware of how valuable that they can be. For the rest of the presentation, I'm actually going to focus on that dissemination angle, and I think that's because of where you are in the module right now, kind of having thought through the stages of a review and steps of a review. You're, I think, at the point now thinking about reporting and dissemination, and so in that kind of that thought experiment of what do we do with findings, I think it's perhaps most useful to focus on knowledge mobilization in terms of dissemination. But I did just want to make sure that I signposted people to interesting work and resources that is done in terms of involving people in reviews, in review processes themselves. So these are two really great papers. They're about involving patients, professionals and policymakers, local policymakers, in interpreting and understanding reviews. And that's a really great, both of those are really great examples of that kind of two-way knowledge production. So actually working with people you expect to use the findings of a review, but working with them throughout so that you're actually building it into the process, building it into the findings, what these reviews are going to mean to people at the end of it. And also a couple of links there to websites with useful resources. So one obviously is Cochrane, who have done lots of fantastic work on this, and they have lots of examples and resources on their website. And another example is the methods stakeholder engagement navigator, which is kind of a repository of lots of different kinds of methods that can be used to work with people. And that's a useful thing to browse if you're interested in that.